Okay. Hi, everyone. Thank you for coming to today's Kernel of Knowledge webinar series, Fostering Mutuality, How One Library Prepared for the Opioid Crisis. I am Bobby Newman. My pronouns are she, her, and hers, and I am your host for today's webinar. This session is being hosted by the Greater Midwest region as part of its Kernel of Knowledge series. For those of you who are not familiar with the Greater Midwest region, we're located at the University of Iowa, hence the Kernel of Corn and our Kernel of Knowledge series. You were all automatically muted upon entry, so please use the chat panel to ask questions or make comments. If you have a technical need, please use the Q&A function. If you use Twitter or Instagram, please feel free to share using the hashtag Lives for Health. We are recording this webinar and it will be posted on the National Network of Libraries YouTube page. Scratch that, we had a name change. We will be posting it on the Network of the National Libraries of Medicine YouTube page for viewing and reference within the next week or so. This webinar does provide one continuing education credit from the Medical Library Association, and I will send the link for that credit with the link for the recording in about a week. I am the Community Engagement and Outreach Specialist with the Greater Midwest region, and I connect public libraries in our 10-state region and across the country with the health information they need for their communities. Like many of you, I am working from home right now, so please excuse my dog, my neighbors, if you hear them. Before we get started in our panel today, I want to do a quick word about who we are. Though you might be familiar with some of these acronyms, some people are a little confused about who exactly we are and where we align in this. The National Institutes of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Institute of Allergy and Infectious Diseases right now, and it is one of the many centers and institutes at NIH. The National Library of Medicine is also an institute at NIH. It is the world's largest biomedical library, which maintains and makes available a vast print collection and produces electronic information resources such as Medline Plus and PubMed. NNLM is the Network of National Libraries of Medicine, and it is an outreach program of NLM. Right now, the NNLM is made up of 8 geographical regions, and I'm from the Greater Midwest Regional Office, which is one of those. And we have an exciting presentation for you today. So with that, I'm going to go ahead and stop sharing my screen. Kevin, you can go ahead and start sharing.
Let's see, sharing. It's asking, I'm sorry about this, everyone. It's asking me, can anybody see it?
Right now, we're just seeing your picture.
Huh. I'm sorry, I don't know why this is not working. We worked on this yesterday.
Yep.
Share screen, let me see if I can make that. Thank you. Got it to work. All right. Can you see that now?
No.
Can't. Share screen. Desktop 2. Share. Share.
There you go.
Word. All right. Okay, everyone. Thank you very much for joining me and allowing me to talk to you today about.
Kevin.
Yes.
We are seeing your whole desktop, not just the PowerPoint.
Okay. Let me. Oh, you're not seeing the Fostering Mutuality?
I am, but I can also see if you're going to get me notifications.
Okay. Sorry about that.
That's okay.
How about that?
There you go.
There we go. Oh my God. Hey, can you guys believe that I used to be head of IT at one point? So you can comment on that as much as you'd like. So yes, my name is Kevin Kane. I'm coming to you from the Kalamazoo Public Library, where I'm actually in my office. We opened up about a month ago to the public with pretty intense social distancing rules. There is like so much tape on the grounds at our libraries right now to like direct you through like a hamster trail. It's kind of funny. And we have so many screens. Well, it's not funny. This whole thing is not funny, but the way that our libraries look now are kind of humorous in some ways. So, but I'm not here to talk to you about COVID. I'm here to talk to you about peer navigators in the public library. So What I first want to start out with is the idea of trauma-informed care. This is a concept that I hope many of you have heard of by now, and it is this idea simply that we should approach every interaction with a patron or with somebody we work with, a coworker, with this idea that they have gone through some sort of trauma. And there's a really amazing research paper and a guide on this in the SAMHSA, which is Substance Abuse and Mental Health Services Administration, Concept of Trauma and Guidance for a Trauma-Informed Approach. And it's a really great guide. It's free. It's a PDF. I really highly recommend people who work with the public on a regular basis read this guide. And as I was starting to learn more about trauma-informed care, I learned about this idea of peer support. And it's one of the 6 key principles that you'll find in this guide. The things that you need to think about, the things that you need to implement in your libraries or in your workplaces in some way to make sure that you are kind of approaching all situations from a trauma-informed lens. And I just want to quickly go through them really quickly because I think it really kind of frames the further discussion of what we've done at Kalamazoo Public Library to respond to the opioid crisis through peer navigators. The first is safety. If you want to, approach situations in a trauma-informed way, you have to make sure staff and patrons feel physically and psychologically safe. So the setting is safe, interpersonal interactions promote a sense of safety, and this is really a high priority. You have to make sure you're looking at your library spaces as a patron and feeling like, yes, I feel safe here. You know, if every other light bulb is blinking or out, if your parking lot lights are out, if there's, broken things on your public areas, people aren't going to feel safe, and you're definitely not providing a trauma-informed care approach. 2, trustworthiness and transparency. Organizational operations and decisions are conducted with transparency with the goal of building and maintaining trust between staff and patrons. So I know I give these presentations a lot, and I'm so used to seeing people's faces when I do them. So I'm just going to imagine your faces when I ask this question, which is going to be, how many of you want to work in a place where you feel trusted and that information is freely shared on a regular basis, and you never feel like people are hiding stuff from you? Hopefully there's a lot of hands raised and a lot of head nodding and maybe some giggles, because we all want to work in a place like that. And that is a key principle to not only a trauma-informed approach, but it's a key principle in a healthy organization, period. If you can go to work and feel like you know what's going on all the time and you're trusted and empowered to make decisions, it's not going to be a fun work. It's not a very healthy organization. And the foundation of most everything we do in libraries today is built on trust. I'm very, very much in line with that. I think trust is important in all levels and everything we do. 3 is the one we're going to talk about today, which is peer support. And this is key for establishing safety and hope. It's building trust, enhancing collaboration, and utilizing stories and lived experience to promote recovery and healing. Now, peer support is this idea, as I just said, of people with lived experience helping individuals. So basically what it is, and we'll talk about specifically what a peer navigator is, but people that provide peer support are saying, I've lived in your shoes. I have this lived experience. I understand where you're coming from. So let me help you succeed in life and get to the next step in your recovery. To be a really good trauma-informed library, this is really, really important, and one of the ways we tackled the opioid crisis. Collaboration and mutuality. This is important, and it's placed on partnering and leveling of power differences between staff and patrons. Everyone has a role to play. We use the term mutuality in this as a title of this presentation, and it'll come up again and again. What we want to do is make sure that that we're all working on equal levels towards this, and there's not this big power discrepancy between staff, but also at the same time, like we talked about with peer being on the same level and being transparent, we want to make sure that we're leveling the power between ourselves working behind the desk, whether we're a librarian or a library employee, also in working at the power difference between us at the desk and the patrons that come into the library. 5, empowerment, voice, and choice. I talked about empowerment a little earlier, but this organization that foster empowerment for staff in approaching the recovery process are successful as trauma-informed care locations, and the organizations understand the importance of power differentials. And we talked a little bit about that. And then finally, the final key principle is cultural, historical, and gender issues. To be a good trauma-informed organization, you have to actively move past cultural stereotypes and biases. Okay, oops, wrong way. Next, I want to talk to you a little bit about the Kalamazoo Public Library and the community that we serve in general. One of the things that I'm frank about is we're a really well-funded, well-supported library in Kalamazoo. We're a Class 6 library in Michigan, which means we're one of the higher libraries. We're in the Urban Library Council. So we're a really big system. As you can see, we have 116,445 service population, 5 locations, about a $12 million budget, which thanks to COVID will probably go down $1 million by next year, and about 121 personnel. In terms of our city and our service area, 71% white, 19% African American, 7% Latino, Hispanic. In terms of education, you can see there, we have a 36.4% bachelor's degree and a 92% high school diploma. That's fairly high, and it's high because I don't know if people have heard of the Kalamazoo Promise. We are extremely fortunate to live in a community where any child who graduates from Kalamazoo Public Schools can go to any college or university in the state of Michigan for free. So that has contributed to a pretty high high school diploma rate in our community. There's our median household income, 26% living in poverty, 10% uninsured. And here's the big one to start our discussion. Every 100 people have been, 63.3 of them have been prescribed an opioid in our community. Next, I want to talk about our partnership with the Recovery Institute. This kind of starts the story. I'm a trained youth librarian, so I like to tell stories. So let me tell you the story about how the peer navigation, the origin of the peer navigator program at the Kalamazoo Public Library, which allow me a little bit of time to brag here. Our peer navigation program is only the fourth established peer navigation program in the country. We modeled our program off the other 3 in Denver, in San Francisco, and in Washington, D.C. Brooklyn as well, and I think Kansas City has started a program since us. So we're really proud to be the smallest of those big cities, but I say that again to let everyone know from all the cities that you're from, no matter how big or how small, this is possible. This kind of program is definitely possible in communities of all varied sizes. So what happened is I was serving on the Kalamazoo County Opioid Coalition. And this was a group of mostly individuals in the medical profession and the social service profession. I had heard about the organization, and I am definitely not a shy librarian, and I elbowed my way to the table. I think the people at the table at first were wondering why a library was there, but then when I explained how libraries have taken a really strong interest in working on the opioid crisis and making sure that we are helping individuals with substance use disorder and helping them get the services they need, they understood why I was there. And they understood why libraries can and always can play a vital role in any community issue such as opioids. So I was sitting at the table, and it was like the second meeting of this coalition, and an individual at the table who I actually knew from our kids go to the same schools. His name is Sean Harris, and he is the CEO of the Recovery Institute of Southwest Michigan. And he said, we have peer navigator or peer support specialists do these things. And I had just read about how San Francisco, Denver use peer specialists, peer support individuals to help provide resources to people that come into the library. So my ears perked up, and afterwards I said, Sean, let's talk about this. And so he and I started to work out a plan to provide peer navigators to the library. My pitch to him was, and this is the pitch I would totally recommend to all of you, is to say, hey, people come to the library to get resources that they need to succeed in life. a peer navigator in the library is just a living, breathing resource that our staff have access to help individuals get what they need to succeed. So a little bit about the Recovery Institute. They have a mission. We are a community of peers embracing recovery. Pretty much the whole organization is run by peers. There's only 2 people, if I remember correctly, that had not lived either unhoused or battled addiction or are working on or struggling from mental illness. Those are things that everyone that works there has gone through in their lives. They're certified by the state. I'll mention this probably later, but peer navigators, peer counselors, peer recovery coaches, they're all certified by the state of Michigan. And they operate really right down the street from us. So, and I know one of the things Sean likes to talk about when we do this presentation is the unique aspects of a peer-run organization. They establish relationships based on mutuality. The whole idea, like we said, of a peer is to be able to reach individuals because they have a shared lived experience. Our peers, the peers we've had here at the library in the past, almost all of them have been out and housed at a time. They've struggled with mental illness, struggled with addiction. So, they've lived that life. They understand where people come from. Instead of me coming to them looking all library-like, they're able to make that immediate connection. Sean likes to say that they walk alongside people in their recovery. They break down myths about people in recovery. I tell you, we love our peer navigators. One of our peer navigators used to come to the library all the time as an unhoused individual before they started their recovery journey. And so we know this person, and immediately right there from a trauma-informed stance, we now know where that person's coming from. We had interactions with that individual, and now they're working with us, and it makes for just a wonderful story, but it also breaks down a lot of myths that the staff here at the library might have had of that person and of people who are similar to that individual. A lot of what they do is refer people to community resources. Like I said, that's the number one job of a peer. And most importantly, they inspire hope. They not only inspire hope with the individuals they work with on a day-to-day basis, but they inspire hope with the staff at the library. And it's just been an amazing partnership. So what exactly is a peer navigator? I touched upon a little bit. Here is the individual in the middle is Sean Harris. We have Shay would be my left, and then Jason on the right. That is our library, second floor of the library. They have a peer navigator table in the library. As you can see, it's branded with our logo and the Recovery Institute logo. Lots of handouts. What they do is they have a station. They have this table that they can work from, but most of the time they're walking around and working with individuals, talking to individuals, and just interacting, just being there for them. Again, a peer navigator or a peer coach or a peer counselor, they have lots of different names. We just choose to call them peer navigators at KPL. Again, they're individuals who have lived experience. I have a great story about Shay. There was a city commissioner who had an organization working to recently released individuals from prison, integrated back into the community. And he wanted to talk to us about our peer navigator program. And he wasn't quite, surprisingly, he wasn't quite sure what the role of the peer was and what the background and the training of the peer. And when I'm in these meetings, I let Shay and Jason and Sean do most of the talking about what they do. And they're just wonderful individuals. And Shay was saying this is what she does. And then the individual who is not only a city politician, but he teaches social work at the local university said, would you think you might need some more training or anything that you can use? And Shay responded, no, I know everything I need to know from just living on the streets. And it's true. That's what a peer navigator does. They take that knowledge and bring it into your libraries to help individuals better their lives. That being said, I want to share with you, there was a news story that happened about our program that really it does a great job of kind of getting the point across of what the peer navigators do in the library. So I would like to share that with you all.
News Channel 3's Alexis Burdine joins us live in the news.
Oh, I knew that was going to do that. Sorry.
News Channel 3's Alexis Burdine joins us live in the newsroom. She tells us about a program it offers designed to give people a safe space. Good morning, Alexis.
Good morning, Jason. The Kalamazoo Public Library is one of 5 in the country jumpstarting a program for people in need. Its Peer Navigator program offers resources surrounding issues like addiction and homelessness.
I get to be the person that I always needed.
That's Anthony Sorrentino. He's a peer navigator now, but he wasn't always on a bright path.
When I was stuck in my addictive behavior or trying to find out how to get the help that I needed, I didn't know where to go.
He says he had nowhere to turn. It led to a downward spiral and eventually jail. He says the library's program helps people in a similar situation.
Food resources, clothing resources, government cell phones, community mental health.
The list goes on, but those are some of the resources. The head of the library says it's partnering with the Recovery Institute of Southwest Michigan. The institute provides peer navigators. Live from the newsroom, Alexis Burdine, News Channel 3.
It's so quaint to see that now, and they have that guide on the table. It says 2020, when we thought 2020 was just going to be another year of hope and moving forward. And so we're in a situation that's quite different. So yeah, that story really helped us out, and it further cemented our program in the minds of the community. We were a little hesitant at first, a little scared that maybe that story would kind of like start a backlash on what we were doing at the library. But one of the reasons I knew this would work in Kalamazoo is that Kalamazoo is a really, really caring community. And I think one of the things that we tend to get cynical about is our community. And overall, I mean, you know your community's best, obviously, but deep down in my heart, I knew that this community would embrace the library providing services to help individuals better themselves, to give them the resources to get a step up, to move forward, and to really be productive citizens. So that was the goal. And we were, to this day, the program's almost 3 years old, and no one has complained about the program. I was asked to speak at another event that had a lot of community leaders that really resulted in some good publicity, some good comments, and some support, not just monetary support, but political support and goodwill, especially with the police, the county and the city police. So that was really, really helpful as well. So what does a peer navigator do when they come into the library? So first of all, they check in with myself or my assistant, Bethany, who helps me manage the peer navigator program. They check in with us to kind of see, what's been going on during the day, if there's any particular people in the library we need to work with or they need to work with. Also, they check in with our security guards. Now, they don't do that in public, so they don't stand out in front of this area you see in the photo here and talk to security, because we want to make sure that there's kind of a clear separation between the two and the services they each provide. I'm really proud of our security staff. It's taken me I'm in charge of security as well, and it's taken me a long time to kind of get a group of guards aligned with our trauma-informed care approach and going into situations that not hot, we say. We don't want to go into situations hot. We want to go into situations with trauma-informed lens. And it's really hard when you work with a third-party company, but I'm really proud of the group that we have now. And they're fully on board with working with the peer navigators. I know in some other locations that have peer navigators, the guards and the navigators don't always get along, but I'm really happy that ours do, because the guards recognize that the peer navigators are a resource to help them keep the library safe. And that's been a total success. So we talked about anything they should know or anybody they need to talk to. So what the peer navigators then do is they just start, doing rounds and walking around the building, talking to individuals, working with them. Sometimes it takes multiple visits for an individual to say, this is what I need recovery help, I've got an opioid addiction, I need help me connect to somebody who can help me get on a road to recovery. The primary driver, as I said, was bringing peer navigators into the library to help assist the library with battling the opioid addiction issues that were starting to rise in the community. This was a hands-on human way to address that issue. We did this in addition to training staff of how to use Narcan and to be aware of somebody who was having an overdose situation. We did with a lot of education, and the peer navigators, I felt like, were going to be the one way that was going to help us, not only with the opioid issues, but with the individuals in our library that, to a lot of staff needed, they needed that leg up, like Tony said in the video. They needed the help to get them moving in the right direction. And the peer navigators just knock that out of the park every time. So they're walking around, they're talking to people. Like sometimes I stand with a peer navigator down the first floor, and not everybody, but every third or fourth person leaves, say hi, they say bye to that person, and they come in and they say hi to the peer navigator. They ignore me, they talk to the peer navigators, because they're there all the time, working with individuals, talking to individuals. Shay here loves to read. And she leads into most things about, like, what are you reading? I don't even have librarians here that ask people, what are you reading? And I have a peer navigator who does that all the time. So that's been great. She's been a great example for that, in that. The peer navigator program kind of was fortunate to kind of spin off some other programs that kind of helped us make connections with individuals and help them get resources. For a while, and we haven't obviously done it in a while, every month we had a program called Coffee and Conversations. And what we did was, when we opened up, we had staff and administrators at the front doors and guards who would say, go on upstairs and have some coffee and donuts on the library, go up to our community room, have some coffee and donuts. And it was a raging success. We'd get 50 to 70 people every time. And here's my favorite part. No, I have lots of favorite parts of this program, but one of the favorite parts of this program is that you would get people who obviously they needed either to talk to somebody, or they needed other resources that we actually had in the room that we can provide to them, because the peer navigator would be there in the room as well. But there are people that didn't need those resources, that were sitting down at a table. The middle class family would sit at the table with an individual who probably hadn't showered in 3 or 4 days, and they were having conversations. We were bringing people together. We were providing this resource of, food, sustenance, but also fellowship, this ability to sit down. And, in this divided world filled with partisan bickering and politics, the opportunity to provide a safe space where people feel like they are safe and they can freely express and talk without fear of ridicule, I think was really important. And to see those conversations happen in front of me was really heartwarming. And I think it made a big difference on a lot of people. There was an individual, I've worked at the Kalamazoo Public Library for almost 22 years now. And for 22 years, I kid you not, there was a man, I've seen this man maybe once a week. And for the longest time, I would try to say hi to him, and he wouldn't respond to me. The Coffee and Conversations last year, the first one he came to, I sat down next to him and started talking to him, and now he says hi to me all the time. And just making that connection, it brought tears in my eyes to be able to finally be able to talk to him when I see him in the library. I mean, I was always talking to him, but have a real conversation between the two of us. So I highly recommend a Coffee and Conversations program. Staff would be, like, certain groups, like youth services, would be assigned to bring staff one time, so they all sit at tables, and we set up like a cafe. A lot of times, a few of us would just walk around and fill people's coffee up. I got to be like, Flo from the old Alice sitcom, and fill people's coffee up and make jokes, and that was really fun for me. And it was just a great program. The Friends sponsored that, and we got some other funding from outside groups. Another program that spun out of this are care kits, and you see Jason up there in the top filling up bags. These kits, we have one for men, we have one for women. They are hygiene kits. They have can openers in them, because one of the things in research-wise I had done is individuals need can openers, because when they go to food pantries, they get cans of food and they don't have any ways to open them. There's something I learned that was very interesting. I also learned that socks are vital, and chapstick is a highly requested item of people who are unhoused and have to fortunately live on the streets. So we have care kits. We don't advertise care kits, but the peer navigators and the guards and staff know that we have them. So they know how to they get access to them, and they can get those and distribute those when needed. When we first started that up, we joked that Bethany, who's in the picture below in the white shirt, she was like a commissary. I mean, she had so many boxes of mini shampoos and toothbrushes and things like that we were distributing. The final thing that really has been really cool for us is that we're now being invited to many more outreach events that we never imagined we'd be invited to. This one here you see in the bottom picture is a self-care event that happens downtown every year. At that event, we not only talked about our Shay, the peer navigators next to Bethany, you can't see her, but we talked about what we do for people at the library. We waived fines that day. I think we waived about $5,000 worth of fines, which was highly successful and led to this year we finally dropped fines totally. So that was something, our goal is to get people in the library, and a lot of individuals, don't come to libraries because they have fines and they're afraid of the library police. And we just wanted to make sure that they know that there's no such thing as library police here in Kalamazoo, and we want them to come. So we were waiving fines left and right, and saw a lot of those people later on in the week. All right, so how do you get peer navigators at your library? I've kind of given a lot of tips on that already, but just to kind of go over some things. Like I said, Sean and I hatched this idea from an opioid awareness coalition meeting, talking about how we can provide people as a resource in the library. And in September 2018, the program started with just funding being 3 hours a week. What the Recovery Institute did, and what many organizations like the Recovery Institute, they're called prepaid inpatient health plans, or PIHP. A lot of states have these programs, and a lot of them have discretionary funds to do outreach. And so what Sean was able to do is take some of the discretionary funding and provide us for 3 hours a week just as a pilot program. So we had one individual 3 hours a week. It was pretty quickly after that person started that we recognized that it was something we need to increase. So in January 2019, we increased for 9 hours a week. And that was, again, we started butting up against that. I had done that community presentation, and we had done a lot of outreach just talking about the program. That in June of 2019, it got increased again to 15 hours a week. Now, you might be wondering, how do you pay for that, Kevin? Because I know a lot of people ask me the question, well, how do you use tax dollars to pay for this program? Well, I justify it as I pay tax dollars to hire security guards to help keep the library safe. And again, the language I use again and again and again are these individuals are resources. They're going to get used more than some of the resources we have in print in the collection. And they're helping. Now, one of the things I had hoped a peer navigator would help us do is help us with security. Because what happened before peer navigators is there would be an incident with someone who might be off their antipsychotic meds, and you would have a librarian or a security guard trying to manage that situation. That's not a good mixture, because I don't know about you, but if you went to the library, for the librarians or people that work in libraries, if you went to school and you learned that in library school, you went to a good school, because none of us learned that in library school. So to have a peer navigator as a resource has definitely decreased the amount of interactions that have escalated. I had a situation where we had an individual who was, he had a hearing problem. He had a hearing issue. And he also had anger issues. So if you could just imagine that, a person who you had to communicate with by writing on a card, who spoke at a high level, a high angry level, it caused a lot of individuals to be scared of him. And one day I had to ask him to leave. And I'm standing there, and I'm not a very tall person. This person towered over me. And I was trying to communicate with him, writing things down. And he was yelling and really loud. And he was getting mad. And then the peer navigator came up and he said, "I've seen you around." He said, "Let's go talk." And our peer navigator took him to a study room and talked to him. And the peer navigator came back to me and he said, "Hey, I want to fill you in what's going on," which is what they always do. And I said, "Thanks, fill me in, what's going on?" He said, "Well, that individual is not only, as we know, he's got a hearing issue, but his batteries in his hearing aid are out, his medication is out, and he can't get a ride to the VA hospital, which is 40 minutes away." And that's when it clicked to me. The peer navigator that gave me that information is the veteran with a hearing issue struggling with mental illness. That right there just summed up why peer navigators are important. He lived this individual's life. He was able to get down in that person's level and relate and get them to bring it down and talk about the options for the angry individual going forth. And it was a beautiful moment, and it really hit home that this was important stuff we were doing in the library. I think this is the future of the libraries. If I'm going to get on my soapbox a little bit, I think within 10 years, we're going to see more and more social workers and peer navigators in libraries. The ALA has been pushing this library as a third space on us for years, yet they haven't trained us to prepare for the third space. And I think some of this is the backlash. We're not trained to approach things at a trauma-informed care approach. We're not willing to invite individuals into our quote-unquote library bubble to do work that needs to be done in a library, i.e. peer navigators and social workers. So I think this is the future. So the funding was great. I jumped off the track there. And then after I had done that presentation in the this early summer of 2019, a group that was getting funding from the federal government to battle the opioid crisis funded us for 50 hours a week. So we went from September 2018 to 3 hours a week to just the end of last year to about 50 hours a week. We employ 3 peer navigators that go to 2 different locations out of our 5. That's been pretty amazing, and we've been pretty excited about the growth of the program. So when it comes to funding, my recommendations are to look to these organizations that use peer navigators, talk to them about how they outreach, because when they have peer navigators, those peer navigators usually go into places like court systems or social service agencies. The peer navigators at the library do those things, and not one of them has not told me that they're way more effective at the library. And I started asking questions why they thought that. And I came to the determination that they're more effective at the library for multiple reasons. One, it's the place where a lot of people who are traveling that are unhoused or dealing with many of the issues that the peer navigators deal with, they usually travel by bus or train. And when they get to communities, the first place they go to is the library, because the library is known in these communities as a place to kind of feel safe. If you can imagine being unhoused and having to sleep under a bridge and having to be constantly on the edge of sleep to protect the only thing you have is your bag, and you have to always protect that. To be able to sit down in a library that's warm or cool, I mean, that's a luxury sometimes for individuals. It's one of the only places in the community they get free internet, and it's one of the only places they can plug their phones in. There's this idea that people from these communities don't have cell phones. Statistically, that's not true. I think the last number I saw was like 98% of our population have access to a mobile phone. So I think that's a misnomer that we've been carrying for a while. So when we build new libraries, having places with a lot of power outlets is something to think about if you're building a new library. So what we ended up supplying was like the table you'd seen. We provided some plastic for displays, a private space to meet. A lot of times they're just meeting. It's a quiet library. So they're just meeting at a space they can find. Oh, sorry. This is life with Kevin, my scattered mind. The other thing I wanted to say was the reason they have success at the library, the peer navigators, is because when they're there, it's not stigmatized. People just come to the library. Nobody, when you go to social services, you're going because you want social services. When you're going to the court, you're going there because you're in trouble. When you go to the library, you're just going to the library. So the peer navigators have greater success talking to individuals, needing resources at the library because of that. They're unstigmatized. You're just talking to some person in the library. Every peer navigator has reported that. In fact, a couple of them said to me once, when they're at other sites, they see a lot of the same people, and those people will come to them and say, I'll wait and talk to you at the library. I don't want to talk to you here. So that's been a great success as well. Okay, I want to leave time for questions, so I'll kind of buzz through these quickly. These stats are from, let's see, they're from they were from September 2018 to, January, this is all 2019, sorry. I was trying to remember the numbers. What you see here are statistics. One of the things that's hard that Sean speaks eloquently about is that the hard numbers you get from this work, you can't really say we had this many successes, because you can work with an individual and get them a housing referral, but once you get them the housing referral and they go off, you're not keeping track of whether they stay in their house or they're evicted. So Sean and I have been talking a lot about how we do measurements and how we get this empirical data. I know a lot of peer navigators will tell you, and they've come to grips with the idea that, when I work with somebody, when I'm done with them, I just have to trust that they're moving in the right direction. But as you can see from these stats, the biggest numbers right now are housing referrals and social emotional peer support. What these numbers won't show you either is that, as I said earlier, a lot of times peer navigators meet multiple times before they get somebody to where they need to go. Many stories of a peer navigator saying, yeah, I finally got through to so-and-so today. One of the questions you might be thinking about now is what kind of information is being shared? We're library people. Privacy is huge for us. And as many of you know, somebody in the medical field, you'll know that privacy is important to them as well. So they're bound by HIPAA laws. We're bound by lots of federal and state privacy laws. The partnership is easy that way. That was an easy explanation. So I don't have a list of every name of every person who's asked for social or emotional support. We just mark male, female, and we know the number. Also, a lot of these people, you don't want to go hard in there as a peer navigator and say, okay, what's your name and give me your full history, because it feels awkward. So they a lot of times work up to just maybe even first name sometimes. So stats are hard. To kind of tout the success of the program, we lean a lot more on anecdotal stories, but we do use these stats as well. And I think they're pretty strong for 1 year, especially in the beginning of the program. Now, I was hoping 2020 would be a better year, but we were closed for 3 months, 100 days. So, and right now, in this period, we are open, but we're only at 25% capacity. The peer navigators are reporting that traffic is slower than it was before COVID, and that's true in almost all the services we provide. All right, benefits to the library. Sorry, my phone is ringing. We'll ignore it. Benefits to the library. Staff support has been great. I was really scared at first that the staff was going to get protective of what they do in the library. but there's not been one program I've introduced to the library that's been more welcome and wanted and needed than the Peer Navigator program. As I said earlier, I wasn't trained. I didn't have a trauma-informed care class in library school. I didn't learn about how to work with individuals going through recovery. So having a resource. One of the other things that before we had Peer Navigators, a story that hung with me forever that helped me get to the Peer Navigator point was the staff that said, I had an individual come to me and say, an adult with a developmental disability come up to the desk and say, I'm hungry, and they didn't know what to do. Now we know what to do. We call a Peer Navigator. The Peer Navigators helped gather resources. We've been able to work together to put out flyers and they're able to vet resources too in the community. They've used them all. They're able to say, that's a good place to go for this, that's a good place for that. Talked about how the advantage of security. There's a lot of times they're the first responder in a security situation. And it's definitely caused the escalations to drop. We've done a lot more work with anti-racism. This is definitely an a program that helps defeat our work towards being an anti-racist institution. And the individuals in our library that are on our anti-racism transformation team fully support peer navigation as a worthy program to help reach their goals. All right, the future. Some of the futures become the present. We now work with Western Michigan University. They provide for the social work intern. The peer navigators help us train staff on many things. It was a main component when we when we restructured, we created a community engagement department. And I'm just about to sign a memo of understanding working with another local organization that has peer navigators for youth. The peer navigators that the Recovery Institute provides to us are not trained to work with youth. That was one of our weaknesses. So we went out and we found an organization who has young teens, early 20s, that are peers that can help with other teens in the library. And that's been going to be a great addition to what we're doing. And they actually got grant. The funny thing is on that one, they got grant money they couldn't spend. They knew about our program because this group works with Recovery Institute, so they came to us. I don't want to go into this too much. So now I'm at the questions part of the presentation. And how would you like to do the Q&A for this body?
Yeah. So I can read the questions from the chat box to you. I think that's a good way to do it. That way we make sure the question itself is being recorded, right? Mm-hmm. So if you have questions, this is the time to go ahead and type them into the chat box. And I'm going to start with the couple that are already in there. Is there always a peer navigator present during open hours, or do they have a schedule that's posted to the public?
Well, at first when we had fewer hours, it was a consistent time. Now that we have more hours, it's almost all library open hours. My recommendation when we first started the program, we thought, we'll look at our gate counts and we'll look at circulation and see what the busiest times of day are to have a peer navigator. Well, that doesn't really work because a lot of individuals who utilize the peer navigators are the patrons that come in and end up staying all day. So they're not going to be reflected in any gate count or circulation. So we had to go by kind of guesswork at first and anecdotal, like we just paid attention to when there was a lot of people and then went that way. The one thing we also learned very early is that, and people that work both a day shift and a night shift will agree with me, that the daytime people and the nighttime people are totally different people that come into the library. So we discovered that pretty early, and so we worked towards trying to make sure we had some more coverage at night to make sure we were addressing some of the needs there. So yeah, that's what we were doing. I think in smaller communities, unless your community is a huge need, I wouldn't think you'd need it all the time. I think one of the things we worry about is I think I have enough things to do. Well, this job is not about producing widgets. It's about being available as a resource to individuals, and you don't know when that person's going to need it. So that's one thing you got to wrap your mind around. If you're one of those thinkers that's like, I'm spending money and I got to have some product from it. It's the product from peer navigation is not going to be as tangible as a widget. That makes sense.
Yeah, that's great. That's a great point, Kevin. Thank you. That's really important. Are your peer navigators library staff, are they hired through a third party?
Yeah, I'm sorry that wasn't clear. The Recovery Institute is our third party source. They provide us the peer navigators, and they pay them, and they have their benefits. One of the things I learned early on is that I did it backwards from the other libraries that had peer navigators. The other libraries that had peer navigators had the social worker first. One of the things you have to be really, really aware of, and this is important, and I'm sorry I missed it, I'm glad this question came up, was that the peer navigators are still going on their own recovery journey. So what you don't want to do is like hire a peer navigator, have them work 40 hours a week dealing with other people going through recovery. It's not a good mental health recipe there. So you want to make sure that that peer navigators have access to someone who can work through the issues that they might be working through that come up when they're helping people at the library. So since I'm not a therapist or a social worker, I made it sure that if the Recovery Institute was going to provide us with the peer navigators, they were also going to make sure that they provided the group help and the therapy and the time for the peer navigators to kind of release steam and talk about the issues they're having and help them on their recovery. What I don't want is a peer navigator to slip. I don't want that. So that's that's why I think it's important to make this a third party thing if you don't have a social worker. Now, I often get this question, would you rather have a social worker or a peer navigator or both? Be quite honest with you, I'm happy I started with peer navigators first. I love social workers. I'm married to a social worker, so I can say this. Social workers and she'll say this as well. She's not a social worker now practicing, but they have a lot more hoops to jump through to get people services. There's a lot of reporting mechanisms, things they have to do. A peer navigator can literally say, I'm going to take you down to social services right now and help you get signed up for things. That's not as easy for a social worker. And it's not necessarily in the mindset of a social worker all the time to do it immediately. So I have social work professors at the school tell me this all the time, that peer navigation is wonderful. And it's really great when you have a social worker and a peer navigator working together. They're coming from a lot of times they're coming from different histories. So working together, they can provide each other all the resources they needed to have some success. So I hope I answered the question. I know I went off on a tangent, but it was good information, I hope. That's something I needed to say.
I think it was important information when people are thinking about starting this program. Well, that's the last question I see in the chat box. So
okay. I have one more slide, which is my information.
Yeah.
And that's my puppy who just turned 2 the other day.
And
I always put that in there because if you didn't like what I said, you'll see a puppy at the end, and it might be the last good memory you have, and you'll think, at least I saw a puppy.
I should just bring my dog in and put her up here.
Yeah, totally. Well, I really want people to a lot of people put their information up, and they do it just because they feel like they have to. Please, please, please use it. If you've got more questions, if you want to challenge me on something, I love it. I love a good challenge. And please use this information and ask me anything you want to know about peer navigator programs. I know it's not super directly tied into the opioid issue, except for saying that it was one of the ways we responded to the opioid crisis, is having these peer navigators here and being available for individuals. And I just want to close with one story, which is weird to me to think about. The Monday, so that would have been, the 8th of March, the Monday before the Friday we all pretty much stopped doing everything for COVID. I gave someone Narcan and saved their life. And if we hadn't been so proactive, we didn't have any overdoses before we started working on the issue. I don't think this is one of those issues where you sit around and go, well, let's wait till it's a problem before it's a problem. having peer navigators was a part of it. They were there helping me. But at the same time, if we did not train our staff to use Narcan, naloxone, and put it at every public desk, that woman would have died. And I'm sure of it. And yeah, I just really want you not to wait too long on this issue. So thank you for letting me talk to you. And again, use this information if you need it.
Great. Thank you so much, Kevin. That was very moving to hear your story too, right at the end. I'm going to go ahead and share my screen again for the wrap-up portion of the webinar.
I need to stop.
Nope, I can stop you, but I have to have, in order for Zoom to share it, I have to have it actually open in the background as opposed to minimized. There we go. Okay. So just as a wrap up here, I want to remind everybody that your best sources for information are the National Institutes of Health. This is a screenshot of the homepage for coronavirus or COVID-19. The CDC is also is the other best source for information on coronavirus. I know there's a lot of information and misinformation going around right now, so make sure that you're getting reliable evidence-based medicine for your resources. In particular, I like to point out this section within the CDC resources on stress and daily life and coping right now with what everyone is experiencing with the COVID pandemic. This is a very stressful time for everyone. And lastly, I want to invite you, if you have an idea for a webinar and you want to be a speaker for me like Kevin, please feel free to send me an email. I'd be happy to host you. If you're not already, please consider joining the network of the National Library of Medicine. We just changed that name. You can join it here. Membership is institutional, not individual, and it is free. It allows you to do a number of things, including applying for funding from us. You can also register for additional webinars and classes at nlm.gov/training, and all of our training opportunities are free as well. You will receive an email from me within 1 to 2 weeks. The email will include a link to the recording of this webinar, a survey to provide feedback on your experience during the webinar, and instructions on how to claim your continuing education from the Medical Library Association.
Almost made it.
Almost made it. All right, with that, I'm going to stop recording and thank everybody for their time.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.